Dear colleagues, my presentation is dedicated to the modern standards of psychosocial care in pediatric hematology and oncology and their families. I mean, for the patients and for the families, and the experience that we have in our center with regard to using these standards. Martha already told us that there have been standards which were actually approved by the cooperative group by specialists from different groups. And I am going to refer to this publication mostly in Blood and Cancer of 2015 when I will speak of those standards. So briefly, let me tell you that these standards are a multidisciplinary team approach, systematic assessment of the psychosocial healthcare needs and the psychosocial and psychological functioning. This is true of both patients and their families. Psychoeducation and information on the disease and treatment, also opportunities for social interaction and education during cancer therapy, follow-up and care for the whole family after active treatment is over, and palliation. The first standard is on a multidisciplinary approach in this area. So we can say that in our center, we have gone a long way of gradual introduction of the staff who deals with this service, who are members of this service, into the multidisciplinary team. And of course, this is important because that means that we have to work together. If in 2004, the clinical psychologists were not staff members of the clinical departments, and actually they were supported by the charity fund then. But after the Rogachev Center was set up, they have become part of the staff members of the department. And in 2013, the clinical psychology department was set up, and that actually made it possible to work more realistically to introduce into practice standards of the psychological service. At present, clinical psychologists are absolutely equal members of the multidisciplinary team participating in counseling and clinical rounds. Since 2015, we have specialized psychosocial rounds, and all the staff members have an access to all medical records. They also would make entries in the medical records of the patients. Well, next standard deals with the regular assessment of different aspects of psychological needs and status in psychological care. And that's important. At this moment, we are working very actively over the development of the, introducing this standard into practice. We come across, deficit of resources and also with the need of restructuring the algorithm of coordination of the medical staff work and also the work of the staff members of the psychological service. At present, we actually do validation of the distress thermometer, which was adapted for children of different age groups by Sunita Patel. One more standard deals with the access to psychological or, if necessary, psychiatric services for the patient and for their families. And psychological service of our center would render psychological services to patients and also their families in all departments of the center, including surgery, transplantation, intensive care, and resuscitation. They would also counsel medical personnel on all questions or issues associated with communication or information about the disease and treatment. Not only clinical psychologists, we also have a psychiatrist, and he would help coordinating our efforts. We do hope that this service will be available to every family of our patients. And the results of many studies show that adequate in time and information and education of the patient on about the disease, about the treatment, preparation for invasive medical procedures decreases the level of emotional distress and improves psychological adaptation. We are developing different, aids for psychoeducation and information for children of different age. And this needs further development. And this could have been promoted by further training of the medical personnel, particularly medical nurses who do these manipulations. And also in our clinics today, we have specialists of child life. And one of the objectives in foreign clinics is preparation of the family for different types and stages of the treatment. I would like to draw your attention to the existing socio-cultural differences with regard to such a severe or difficult disease as cancer. And information about this disease of the patient, particularly if that patient is a child. In 2014, 2015, we have done a survey among parents of our patients. And we saw, as a result of that survey, that 30% of parents have anxiety when they are afraid that children will be informed of the disease. They also are afraid that children will learn of all the difficulties and duration of the therapy. And also some of them are, scared to tell anybody about this disease. So this is stigmatized as much as it could be. And the standards associated with the social interaction and also continued education and schooling of our children is done for the patients thanks to the volunteers of the charity funds. The volunteers do have special training, and they come to all departments of our center, and they work with patients and their families in the center and also at home. I'd like to extend our heartfelt thanks to all our volunteers for that. Well, it is thanks to the active participation of the patients' organizations and the charity funds. The palliation is discussed, the access to palliation is discussed, and this is something which is very actively discussed in our country. We still are away, we are not yet there, and we still have to do a lot for this to become accessible to everyone. In most cases, families meet specialists of the palliation services upon discharge from the clinic. And these specialists do not participate in support of family after child's death. And this, of course, reduces the efficacy of the palliation. And the palliation service probably is now just following in our steps, which we have already done, we clinical psychologists, when our work was not part of the whole process in the treatment of the patient and was paid for by the charity funds. And the final standards is the comprehensive support of the family upon the completion of the active stage of the disease. We understand that this is absolutely important. And in 2013, we have set up a rehabilitation center, which is called Ruskое Поле. And that's the center which develops the program of rehabilitation. And actually, we will need to continue this work. It seems to be very, very useful. So I'd like to finish by saying that there are still challenges and open issues, and we will, in developing psychosocial services in accordance with the standards that I have described to you. So we do need a continued training of the staff members in the psychosocial service and medical nurses, physicians as well. So we also have to improve the psychosocial service. Also, we lack specialists. Particularly, we don't have enough number of child life specialists, And we have to continue this validation of specialized methods of assessment. And as for the socio-cultural aspects of perception of the disease and treatment, so this is something which needs special attention. And we understand that we have to unite efforts by patients and charity organizations, and as well as medical centers, to gradually alter the traditions. And we can, well, the Russian psychological studies grow in number in this area, and they will contribute to improvement in this area. Further development of the palliative services assumes that there should be early integration of the concept of the palliative service and specialists of the palliative team. Thank you ever so much for your kind attention.